This is the instructional video of the donning and doffing, or the proper wearing and removing of personal protective equipment used in the laboratory. In this video, we will show you the proper way which will be done before and after every laboratory activity. In this exercise, you will need the following materials: your nitrile gloves, your coverall, a respirator, your hair cap, your safety goggles, your shoe cover, and a liquid hand soap. Reminder that the risk assessment was done by PUA-CMT in accordance with WHO and CDC guidelines for the proper PPEs used. There must be a trained observer to review the steps with a checklist containing the donning sequence. Prepare all supplies and ensure that sizes are correct. Prepare for donning, and in the absence of laboratory shoes, an impermeable shoe cover can be used. Ensure that pockets are empty. Remove your watch and other jewelries. For ladies, tie your hair. Perform hand hygiene. First, remove your jewelry, then wet your hands with water. Apply enough liquid soap to cover all hand surfaces. Rub hands palm to palm. Right palm of the left dorsum with interlaced fingers. Do this vice versa. Next, palm to palm with interlaced fingers. Backs of the fingers to opposing palm with fingers interlocked. Do this vice versa. Next, rotational rubbing of the left thumb clasped in right palm. Do this vice versa. Rotational rubbing backwards and forward with clasped fingers of right hand in left palm. Do this vice versa. And lastly, rinse your hands with water. Dry thoroughly with a single-use towel. Use towel to turn off faucet. Put on your inner gloves. Put on your coverall. Note that the coverall must be big enough to allow free movement. The cuffs of the inner gloves must be tucked under the sleeves of the coverall. Insert your thumb into the holes of the sleeves of the coverall. Put on an N95 respirator. Cup the respirator in your hand and position the respirator under the chin with the nose piece up. Pull the lower strap and position it around the neck and below the ears. Pull the top strap over the head, resting it high at the back of the head. Mold the nose piece using 2 fingers of each hand to the shape of the nose. Do not pinch the nose piece using one hand as it may compromise the respirator's performance. After which you have to perform seal checking. Put on a hair cap. Put on your safety goggles. Put on your hood. Make sure that the coverall hood covers all the hair, ears, and neck with no skin exposed. Put on your shoe covers. Put on your outer gloves. Ensure that the cuffs are pulled over the sleeves of the coverall. Let the trained observer check the worn PPE. Make sure that all parts of the skin are covered. In the Doffing, you will need the following materials: a yellow leak-proof trash bag, your 70% ethyl alcohol, and your liquid hand soap. The PPE should be removed in the designated Doffing area. The removed PPE should be placed in a yellow leak-proof bag for infectious waste. Doff PPE only with the supervision of a trained observer. The trained observer must remind the clinical laboratory scientist to avoid actions that may put him or her at risk, and review the doffing procedures to the clinical laboratory scientist. Inspect the PPE for visible contamination or tears, and in case of contamination, use 10% bleach to wipe it off. Disinfect the outer gloves using alcohol-based hand rub. Remove the outer gloves. Be careful not to contaminate the inner gloves when removing the outer gloves. Discard the outer gloves after. Disinfect the inner gloves using alcohol-based hand rub. Remove the hood. Grasp the back of the hood and carefully remove by pulling backwards. Do not touch the inside of the hood. Disinfect the inner gloves using an alcohol-based hand rub. Unzip the coverall. Remove shoe covers using hands-free technique by stepping on the back of the cover and lifting the foot. Touch only the inner surface of the shoe cover when disposing. Disinfect the inner gloves using an alcohol-based hand rub. Remove the coverall. Avoid contact of the scrubs with the outer surface of the coveralls. Touch only the inside of the coverall when rolling it prior to disposal. Disinfect the inner gloves using an alcohol-based hand rub. Remove the goggles by lifting the strap at the back over the head. Pull out and away. Avoid touching the front surface of the goggles. Disinfect the inner gloves using an alcohol-based hand rub. Remove the hair cap. Disinfect the inner gloves using an alcohol-based hand rub. Remove the inner gloves carefully so as not to contaminate the bare hands. Perform hand hygiene with an alcohol-based hand rub. Put on a new pair of gloves and disinfect it using the alcohol-based hand rub. Remove the N95 respirator. Tilt the head slightly forward and grab the bottom tie or the elastic strap. Then grab the top tie or elastic strap. Remove without touching the front of the N95 respirator. Discard the respirator and disinfect the gloves using alcohol-based hand rub. Remove the gloves and discard. Perform hand hygiene. The trained observer should inspect for contamination. Remember that proper donning and doffing of your risk-assessed PPEs can save your life and save others' lives.